The reason doctors stopped making house calls is because they got too darn busy. They got too many patients and they needed to see 25, 30, 35 patients a day in the office. A lot of empathy has been withdrawn from the practice of medicine by insurance companies and by HMOs and PPOs and by systems, hospital systems that turn patients into numbers. And you can't feel like you're being cared about when you feel like you're being treated like a number. That's one of the primary reasons that people least seek out a concierge doctor. They're looking for a concierge doctor because they're fed up, sick and tired, up to here, whatever euphemism you want to use, with the system the way it is, where they get treated like a number. You don't get treated like a number here at Primary Caring. You get treated like a member of the family, like a friend. Once upon a time, there was a situation where doctors and patients made decisions together without interference from outside entities. Insurance companies began to take over the whole healthcare industry, HMOs, PPOs, network, in-network, out-of-network, hospital systems, and as a result of that, people felt like their doctor was no longer in control. They were no longer in control. You were no longer in control of making these decisions. It has to be, well, is your insurance going to cover it? Or will your insurance allow you to see this particular specialist that I'm recommending? Or will your insurance allow you to take a drug that I'm recommending? Who do you want making your healthcare decisions for you? Your insurance company or you and your doctor?
I'm considering really doing the best for my health. Like, what would you say to that?
I would say that if your health and your happiness are your primary goals and your financial well-being is necessary to support those things, I would say that you don't have the things in the right order unless you have health first.
Right.
Because you obviously can't be productive without your health. You obviously can't take care of your family without your financial stability, and you can't earn a living if you're not healthy. So it's amazing how many people put wealth ahead of health. You know, I'm working too hard, I don't have time to go to the doctor, I don't have time to have a mammogram, I don't have time to have a colonoscopy, right? Well, you got it backwards. You know, you need to do those things so that you're going to be around to show up and do the work and do the things, the creative work that you're inspired to do, and that generates the financial stability, the wealth. I make sure that I'm dialed in to whatever you're doing, and I always tell people, think of me like a stockbroker. Do you buy it? Some people do research and buy their own stocks, but a lot of people use a financial advisor, you know? So if you wouldn't make a big investment, like getting back to health, wealth, and happiness, when it comes to your wealth, if you wouldn't make a big investment before checking with your financial advisor, why would you make a big health decision without checking with your health advisor?
Right. Availability problems is another reason why sometimes a month goes by and I haven't made the appointment.
I make it a point to make sure that people get responsive, attentive care by being available. We have a limited number of patients here, so that I get to know everyone very well, and they get to know me, the doctor who's on top of his game. So you want a doctor that stays up to date, which I do. You want a doctor that's well trained, which I am. You want a doctor that's got lots of experience, which I have.
Yeah.
My practice is designed to limit the number of patients that I have, because they come in and we sit down for half an hour, no charge for this visit, and I find out, I'll ask you exactly, why is it that you're looking for a new doctor? What is it about the previous health experience that's been unsatisfying for you, dissatisfying? What experiences are you looking to have with your doctor? How do you feel about paying a little extra for your care? I make it my business to know who are the best people in every field. Now, I'm a generalist, I'm a family physician, which means I'm supposed to know a little bit about a whole lot of things, right? But you're going to need occasionally, some point in your life, a subspecialist or specialist who's going to have a great depth of knowledge in any one particular field. And it's my job to make sure you get to that person. And it's also my job to communicate with that person, to pave the way for you before you go see them. Call them ahead of time and say, hey, thanks for seeing my patient. You're going to see my patient next week. Here's the story. You know, and then when you walk in to see that specialist, that doctor's going to say, oh yes, Dr. Barron called me about you last week.
That's what I want.
Instead of, oh, so why are you here today?
Yeah.
You know, I also then speak to specialists after the fact. I will call, if I don't get a report the same day you saw the orthopedic surgeon, I'm going to call the orthopedic surgeon and say, what did you think of Francisca, and what do you think of her problem? Does she need knee surgery or doesn't she? You know?
Yeah.
Because he probably gave you that information, he or she. And patients walk out of subspecialty visits with their heads spinning, right? There's studies that say that patients don't hear anything after they hear the word cancer, you know? And they only remember 10% of what you tell them. So how do you deal with that? Well, harking back to what I said earlier, you have to make a connection with somebody, right?
Yeah.
So you bring up a really good point about people doing their own research about their health. It's really natural, normal, and even good that people do that. When they get a new diagnosis, or they've got a symptom, or they've got something that runs in their family and they want to know if they're at risk for it. Intelligent people go do the research. The problem is sorting through the information. There's information overload right now. And in medical school and in medical practice, you're trained to be able to look at research, look at data with scrutiny, and to be able to say, this was a good study, it was well designed. The people that did the research are not in the pockets of a pharmaceutical company or a medical device manufacturer. That there's no bias, no other bias. And I have enough time and enough distance from insurance companies to be able to provide mostly whatever you need on any given day. The doctor will spend no more than 30 minutes with you for an annual physical. I'll spend an hour and a half. And we'll go over everything from head to toe. We'll go get into your preventative care too. Now, people are understandably hesitant to go through procedures like colonoscopies, endoscopies, even mammograms. I have some patients who refuse to have mammograms because they've heard that it's too painful. You have to acknowledge people's fears about the unknown. You have to meet people where they are. I get it, I hear you, I understand why you feel that way. The capacity for a doctor to be effective is directly related to how much you trust them and how connected you feel to them.
Yeah.
You need a personal connection with your doctor to feel that kind of trust and to take that advice that you might not be otherwise inclined to take.
Absolutely.
So again, you build that trust over time, but I'm really good at helping people understand my credibility, pretty much from the get-go.
So what's next for me then if I'm interested in becoming a member?
Well, I would encourage you first to go to our website, and that website address is on the screen right now, primarycaring.com. You'll find lots and lots of information about the practice, about concierge medicine, and you'll find examples of my work in media and educational pieces that I've done on various health topics. And then if you're really serious about your health and your happiness and your wealth, then you need to give us a call and come on in and have a conversation and meet us. Or you can call and we'll send you an informational package that you can start with, and then after reviewing that, then come on in. I think face-to-face meetings are the way to really find out whether this is the right practice for you.